Hi, my name is Dr. Susanna Lynn. I'm a licensed physical therapist in the state of Washington. This video is going to be about plantar fasciitis, heel pain. These are the exercises that I will typically give someone with acute heel pain, acute plantar fasciitis on their first visit when they come in. Always it's recommended that you see a physical therapist or doctor before you start any exercise. This video is for education, it's not to diagnose what's specifically going on with you. Okay, so if someone comes in with heel pain, plantar fasciitis, one of the complaints they'll frequently have is that when they first step on their foot in the morning after they've been sleeping, or if they've been sitting for a long time, they take those first steps, they're having pain in their heel, sometimes pain in the arch of their foot. Okay, that's very typical of plantar fasciitis. So these are the exercises I would typically give on the first day. The first one is with a Thera band, if you can get your hands on one of these. So you are going to put the Thera band around your foot like this, okay? Now you're not gonna have any tension on the band and you're gonna point your foot. Now you put tension on the band and then you slowly bring the foot back towards you. This is called eccentric plantar flexion, okay? Eccentric plantar flexion. So you're going to push your foot down, put tension on the band, and then slowly bring the band back. Okay, release the tension, push down, put tension on the band, slowly bring the foot back. It's a little coordination involved to do this one, okay? So I would have somebody do that 10 times. You do 10, you do that for a week or so, your pain's getting maybe a little better, you're starting, it's not getting worse, then you could do a second set of 10. Then, progress as that gets too easy to like a third set of 10. Down the road, a week or two, you're feeling a little bit better, the exercises are not irritating your symptoms, then you can just have tension on the band the whole time and just go back and forth, okay? But in the beginning, when it's sore, when it's new, when it's irritated, just do just the eccentric part of it that we showed you, okay? So that's exercise number 1. Exercise number 2 is an arch lift with your foot. So if a lot of us stand with feet that are maybe pronated or flat feet. And so what we want to do is work on the muscles inside the arch of the foot, okay? So you're going to, this is not a neutral position of your foot. Your foot ideally should be about here, okay? So you're going to work on these muscles, which is where your feet ideally should be all the time. So if we're gonna start here with like a relaxed foot, and then you're gonna try to lift up this arch here in your foot. You're gonna keep this part of your foot on the ground, but you're gonna try to lift up this arch, okay? And then you would hold that for 5 seconds. 5, 4, 3, 2, 1, and relax. And then you would do that again. Lift up, 5, 4, 3, 2, 1, and relax, okay? This I would give you also for 10 times, okay? Now, you're not curling your toes. You're not rolling onto the side of your foot, okay? This exercise can be tricky for people because it's not a muscle that we typically activate on a regular basis or ever think about. So give yourself some time to kind of figure it out. If you're having problems kind of activating that muscle, one workaround we can do sometimes, if you're relaxed with your foot and you lift your toes up, you can see that as I lift my toes up, my arch comes up. Okay, you see that? So I lift my toes up, my arch comes up. So now, if you want to do it this way, lift your toes up, your arch comes up. Now keep that arch up and slowly lower your feet down. Okay, so that's one way to kind of help you get where that muscle is. And then you would hold it for 5, 4, 3, 2, 1, and do it 10 times, okay? So you can relax your feet, lift your toes up, that brings your arch up in the majority of people, okay? And then you let your toes slowly come down while keeping that arch up, okay? So these exercises, these arch lifts, you'll hold 5 seconds and then repeat 10 times. Okay, the next one is a stretch. It's a typical calf stretch. Some people call it a runner's stretch. Okay, so you're going to get in this sort of lunge position. you're stretching the foot that's behind you. Make sure again that you're not kind of like collapsing that arch as you do it. Okay, so your foot should be relatively straightforward, maybe just ever so slightly off to the side, but it shouldn't be down like this, okay? So you're gonna be in this position, you're gonna be lunge. If you want, you can hold onto a wall. A lot of people, I'm not in a good position to hold onto a wall, but if you have a wall there, you can hold onto a wall. And you're gonna lean forward till you feel a comfortable stretch in your heel, okay? This stretch you're gonna hold for 30 to 60 seconds. Make sure it's not less than 30 seconds, okay? Make sure you're just going to a range that you feel tension but not pain, okay? So you're gonna find that spot where you feel tension, not pain. You're gonna hold that stretch for 30 to 60 seconds. And I would do this 2 to 3 times, you know, depending on how long you're holding it, what's comfortable, okay? And then there's a few things that are not exactly exercises, but suggestions, okay? So you're having pain often when you first step on your foot. So you're in bed. Before you get out of bed, in order to make, like, sort of warm up the joint a little bit, move your feet around. So you've been laying down and you want to get out of bed. Spend 2 minutes, 1 minute, just kind of moving your feet around, okay? This will make it often a little more comfortable when you first step on your feet. Same thing if you've just been sitting for a long time, maybe you're at work and you're gonna stand up, just circle your feet around for a minute or 2 before you actually step on your foot, okay? Another recommendation is not to walk barefoot in your house, especially if you have like hardwood floors, but to wear something in your house that is, for as far as footwear goes, the cushier the better, okay? So a nice good cushion is going to be a shock absorber so that you're not getting so much force on that heel of your foot, okay? So don't walk barefoot in your house. I really like these type of sandals. These are called, this brand is Cushionaire. There's other ones that I've seen, they're not always as cushy. So the brand that I like, that I know works well, is Cushionaire. But if you have something similar that is nice and cushy, like really soft and squishy, you can wear this. I personally have a pair for like inside my house, and then I have a pair for outside my house. Okay, so you can wear something, but definitely don't go barefoot in your house, because that is not giving you any cushion, okay? And when you're wearing your shoes outside your house, if you have cushioned, like soft cushioned shoes for your heel, that can be really helpful. Ofos is another brand that's very cushy. Now the exception to this is if you have balance problems. If you have balance problems, I would not tell you to wear a shoe that is so cushy, because it might be harder for you to balance in, okay? And then another recommendation is to massage this arch of your foot, okay? So there's a couple ways you can do that. You can use a tennis ball, and you just kind of roll it around on the arch of your foot. If you find a spot like that's sort of sore, just kind of work that spot out a little bit, okay? But anywhere like on the bottom of your foot that you're finding tension, just kind of roll it out, okay? I also like rollers like this that you can use if you wanted to buy one, and you can roll out your foot. These, you know, it's good wherever you sit a lot during the day. If you sit at a computer in your house, if you sit by your couch, just kind of keep these there, and when you sit down, just kind of massage your foot a bit while you're there, okay? Some people also like to do that massage with a frozen water bottle. You could do that. And then the other thing that you can do is simply ice. So you would just put ice on the painful area for about 10 minutes. And you want to do that after you've done these stretches and exercises, or after you've done a lot of activity and your foot is sore. But you don't want to do that, the icing before stretching. You want to do that at the end. Okay, I hope this helps. Thank you.